Hello, ladies and gentlemen. I am Dr. Radha Karnad, a 2024 Signature East Africa Leadership Fellow, and I'm very honored to be here today to present to you my project, which is A Woman's Touch, Institutionalizing Gender Smart Best Practices in Healthcare Startups in Kenya. This project emerged from my own experience as a leader in a healthcare startup, where we were constantly facing a challenge between the financial demands of the organization on paying salaries, on keeping the electricity going, on figuring out how we were going to fund the organization month on month, and our desire to be truly gender smart and gender equitable, which often comes at a cost, a financial cost. And I thought to myself, this cannot be a challenge that just us are facing. And I was very delighted and honored to have the opportunity to use my WomenLift Health project to look into this and try and develop a resource for ourselves and for others in how we can address this really critical challenge. We need to talk about it because the global labor force participation is very skewed, with only 47% of women represented officially within the global labor force. And while women are rising up through the ranks, they are gaining more management positions, it's still a lot of opportunity for improvement. As you see here from the data in Africa, it's still only at 20%. And that in the last decade has only improved 1%. It was at 19% at the beginning of the decade. The larger the company, the less likely it is that they will have a female CEO. And most women within organizations tend to have business support functions rather than strategic management functions. Yet there is a lot of evidence that both from an equity and ethical perspective and from a business perspective, that organizations do better if they have gender diversity within them. And gender diversity initiatives really improve business outcomes. So there is a business reason to do this as well. My project was looking to build a resource, as I mentioned, and there were 4 steps to that, starting with the literature review, then semi-structured interviews with organizations, both health and non-health, both startup and larger established organizations across Africa, then moving to implementation and testing within HealthX Africa, which I co-founded, and finally, hopefully, to a publication that can be used by others also looking to build out in this space. The literature review itself was very illuminating in that there were few key findings for me. There's a lot of literature around gender equity with a real focus on female entrepreneurs and leaders. But when it comes to how do organizations inherently build gender equity across the organization, there's really very little literature around that. And even less when it comes to acknowledging the sociocultural demands placed on women specifically and how that conflicts with the financial and business demands on startups. The interviews are underway at the moment. I've been very fortunate to have 6 out of my 15 or so already completed. And a lot of them are WomenLift Health introductions or WomenLift Health individuals. And I'm very grateful for that. The interviews themselves have been super helpful, validating that this challenge is a challenge across organizations, that there are no real quick wins. And that a key need at the moment is to measure the challenge, that we don't even do that right now. And if we don't measure it, we can't improve it, we can't change it. The one thing that has come out very clearly as critical for those organizations that are doing things well is leadership. It is typically one individual or a small group of committed leaders who are willing to take on the cost, who are willing to take on the challenge, that are driving change. And I think that's something that we all need to consider when we think about how is this going to be scalable into the future. I have received multiple requests for these project findings from individuals and organizations that I've been interviewing. And that to me shows what an opportunity this is to scale this learning as we develop it, as I develop it. This is a challenge that keeps me up at night. And this project has allowed me to really strategically find ways to address it, to gain the validation that it's not a problem just inherently for us alone, and to start to consider and compile steps that hopefully ourselves and others can take in making a difference. The intended impact for me is very obvious. I would like to develop clear and implementable systems and strategies that acknowledge these unique social cultural demands placed on women in the workplace, that acknowledge that there are unique demands, financial demands placed on businesses, especially startups, and that find a way to bring these together so that we don't say that it's impossible to do important gender equity work, especially within startups. The journey for me has been really, really exceptional, and I'm so grateful for it. I've moved into a new leadership position during the fellowship, and the mentorship, the coaching, the understanding for me of my style when I manage conflict, my style when I manage partners who are different, my style when I manage work-life balance has been absolutely critical for my growth as a leader, and I'm very grateful for that. So I intend to keep doing the hard things until the hard things become easy. This project is one of those, and the outcomes of this project is one of those, and I'm very grateful for your time today. Thank you very much.